Welcome back. And joining us now is Africa 54 health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. Hello, everyone. As we start this new year, we are going to take a few moments to look back now at some of the health news highlights of 2013 in Africa. Road safety was on the global health agenda in 2013. The Global Status Report on Road Safety released early last year said worldwide, the total number of road traffic deaths exceeds 1 million per year. Over 90% of the world's fatalities on the roads occurred in low and middle income countries. Nigerian taxi rider Mbakwe says he knows who is to blame.
If you look at the 100% accident that is being happening on the highway, drivers are the cause of it.
Observers say there is a need to implement road safety laws aimed at decreasing accident key risk factors. Drinking and driving, speeding, and failing to use motorcycle helmets, seat belts, and child restraints. There was encouraging news in 2013 regarding malaria. British drug maker GlaxoSmithKline's malaria vaccine. The vaccine known as RTSS was found to almost cut in half the number of malaria cases in young children in the trial. It also reduced by around a quarter the number of malaria cases in infants. Dr. Walter Otieno, a researcher with the U.S. military's Walter Reed Research Unit, took part in the research project.
Basically what we did was one arm got the malaria vaccine, and this was given at the time they were recruited, after 1 month, after 2 months, and then with a booster dose after 20 months. The other arm, we had those who got the vaccine at the time they were recruited, after 1 month, after 2 months, but then at the 20th month, instead of being given a booster dose, they were given a comparator vaccine. A comparator vaccine is really not a placebo.
Malaria, a mosquito-borne parasitic disease, kills hundreds of thousands of people a year. Most victims are children under 5 in Africa. WHO says most countries are making good progress on preventable childhood illness. The health of the people, the first report of its kind to focus on the health of the 738 million people living in the African region, says overall, measles deaths have declined by more than 50% since 1999. The report says polio is close to eradication. However, polio found its way back in the Horn of Africa in 2013 when the first case was confirmed in Somalia in May, followed by Kenya, Ethiopia. The polio outbreak in the Horn of Africa was on the decline by the end of last year. With regards to HIV/AIDS, there is some progress on the continent as more and more people are receiving life-saving treatment. However, preventing new HIV infections remains a challenge. In addition, non-communicable diseases such as hypertension, heart disease, and diabetes are on the rise. Another challenge remains the high rate of maternal and newborn mortality overall in the region. And joining us in the studio is Dr. Koki Agarwal, Director of the USAID's Maternal Child Health Integrated Program, MCHIP. Dr. Agarwal, welcome to the program.
Thank you.
So the report ended with very disturbing, let's say, news, so to speak. Africa has the highest rate of neonatal death in the world. This is a bit disturbing. What do you make of it?
Well, I think that typically Africa has had poorer indicators than many other countries, but I feel there have been many changes in 2013 and the years before that where African countries are making big strides now. So I feel like it's going to be a happier new year for women and children in Africa, because countries have made the decision to invest in maternal neonatal health programs to save the lives at the time that is needed.
So some of the specifics in terms of the good news in 2013, can you enlighten us?
Yes, for instance, many countries in Africa came together for a global newborn health conference in April of last year, where simple strategies that can save newborn lives were discussed and decided on how these countries can take these activities forward in their own ways. And many countries have since then taken simple practices like kangaroo mother care, holding a baby which is low birth weight, right to your chest right after birth, or making sure that the baby is dried and warmed right after birth and not left out in the cold to prevent hypothermia. All of these simple things that don't cost a lot of money but can save a newborn life are now being rolled out and practiced in these countries. So I'm really hopeful that countries that have seen the evidence from other countries and how it's working will be adopting them in their own country.
When we look at child's health and baby's health, we really cannot dissociate it from maternal health, right? The two are really very much close.
Oh, absolutely. We consider at Maternal, at the MCHIP program, and globally, we consider maternal and newborn health as a dyad and never to take them separately. So actually, WHO just released the postpartum, postnatal guidelines that highlight what needs to be done both for the mother and for the newborn. And even in the conferences that we have had and the country programs that we run, we have seen that more and more countries are looking at it in a more integrated way. And they're doing things that are impacting the mother, including looking at the use of family planning. For instance, family planning has a strong impact on saving maternal lives as well as newborn lives. And recently there was a global international conference on family planning in Ethiopia, which brought together thousands of people from different countries in Africa and other Asian countries together to learn about why family planning matters for saving maternal and newborn lives.
And quickly, moving forward, what do you see as some of the priorities?
Well, I think that countries really need to make sure that once they learn of these new interventions, that they make sure that these interventions are rolled out at the country level and that they have systems in place. And they have to still look at the few women who will not make it into facilities to have programs supporting them at the community level. For instance, looking at giving them misoprostol, which is a tablet that prevents postpartum hemorrhage at the time of birth.
Okay.
So right after birth, if they can use that at the community level, if women don't make it into their facilities.
And that's very important. Dr. Agarwal, thank you so much for joining us today.
Thank you.
And that was Dr. Koki Agarwal. She is the director of the USAID's Maternal Child Health Integrated Program. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.